My name is Dustin Cook. I'm the Veterans Program Manager at the Columbia Center for Urban Agriculture. The Center for Urban Agriculture was started in 2010. CCUA and Truman VA started meeting and talking about a partnership in 2018 when CCUA had formalized their partnership with the City of Columbia and secured the funding to begin construction on the agriculture park, which is the current main site for the organization. They decided that they wanted the original CCUA farm site on Smith Street to remain in operation. They started looking for a community partner to make some plans for that. So our executive director, Billy Polanski, happened to meet some folks from the VA and they expressed interest. In 2019, they signed a contract for the program to move forward, and we stood the program up in 2020. The Veterans Urban Farm operates on a model of providing both therapeutic, vocational, and recreational garden activities to local veterans. We provide gardening activities in conjunction with several different VA programs, as well as some of our own internal programming. We capitalize on the inherent therapeutic value of gardening to help local veterans who might be struggling with things like PTSD, traumatic brain injury, and so forth. We work with the VA and their vocational rehabilitation program. The VA's Voc Rehab program exists in every VA hospital across the country. And what's unique about our partnership with the VA is that it's the only location that is off-site outside of a VA facility for those Voc Rehab training programs. So we work with the Transitional Work Program, which is under Voc Rehab. And the purpose of that program is to help veterans that are struggling to gain or maintain employment, and they are able to enter the program and be paid to learn new vocational skills and to refresh the kinds of soft skills that help in any job situation. Our initial stand-up of the program is based on a 3-year pilot. And so we're now in year 3 of the pilot program, and we've been gathering data. We're having a lot of success with veterans being able to more effectively cope with the things that are keeping them from maintaining or getting employment when they're struggling with substance abuse addiction problems or traumatic brain injury or PTSD or various other kinds of diagnoses. We're having a lot of success with them being able to manage those symptoms. We're noticing that our attendance rates are higher than some of the in-house programs and that we're having fewer folks drop from the program early. It's in some of those peripheral data points that we're seeing a lot of improvement in an environment that is outside, it's in fresh air. They're being a lot more successful. It seems like that therapeutic environment that isn't so clinical and isn't so confined is helping these veterans to kind of get their feet underneath of them and be able to perform better as potential employees. The recreational therapy program is a component of the VA's inpatient rehab program. When veterans enter the inpatient substance abuse rehab program, one of the components of that is recreational therapy. And so what that means in the context of the Veterans Urban Farm is that during the months of the year that are coinciding with the growing season and good weather to be outside, once a week, we have a group that comes out, and it's usually between 12 and 15 participants, and they come out and are able to participate in garden activities as a component of that rehabilitation program dealing with substance abuse and addiction. They're looking for something positive in their lives to replace their focus on whatever it is that they're struggling with something positive to do, and a lot of them are turning to gardening to do that. The Nutrition education program in the hospital is part of the VA's initiative to improve the health of veterans by providing them education and access to healthier food. A lot of veterans struggle with maintaining a healthy diet. Part of that is because as military service members, you don't really have to worry about making your own food. Some of these folks spend between 4 and 20 plus years in the military and come out of that experience not really ever having had to think about their diet and don't really know how to make good dietary choices and don't know how to prepare foods in a way that makes them appealing. What the VA has seen is that, especially in older veterans, there are a lot of health issues that are either stemming from or exacerbated by poor diet. And so the nutrition education program is part of the VA's initiative to combat that by improving the diets of veterans. And so, how that program works is that they host classes, and these classes will show how to prepare nutritious meals with fresh produce. And how we are participating and partnering with them is that we provide them with fresh produce to use. We have provided to them quite a few different varieties of produce in the categories of root vegetables, so carrots, turnips, beets, radishes, leafy vegetables, lettuce, Swiss chard, kale, collard greens, and then a lot of your traditional summer garden crops, tomatoes and peppers, okra, green beans, and even some fresh herbs as well that we've grown. We donate all of what's grown on site to local veterans in the community. The bulk of our donations happen directly to veterans and their family members at weekly produce giveaways at Truman VA Hospital. And then, in addition to that, we also donate to Welcome Home, the local veterans homeless shelter, and to the food pantry in their veterans program. And something that's upcoming and new in 2022 is that we are partnering with the VA hospital and the food pantry to open a small pantry within the VA hospital. We'll provide fresh produce for that as well. And we're hoping that that program will be up and running by late spring or early summer. They can go to the VA and receive their health care, and most veterans that are going to the VA go there fairly regularly. And so, therefore, having some sort of a pantry facility inside the hospital makes it easier and more accessible for them to get the food that we're already trying to get to them. Forming community partnerships is a priority at Truman VA, and they have worked hand in hand with us since we stood the program up. And I would say that we've been more successful than we could have hoped for, especially given the circumstances of the pandemic and the roadblocks that that has put up for them as a medical facility. The bulk of CCUA's funding comes from a combination of grants and private donations. The Veterans Urban Farm is underneath of a 3-year pilot grant that was given to us by the Missouri Foundation for Health. Moving forward, we will likely apply for additional grants in the future. We will also rely on the generosity of organizations and individuals who donate to CCUA. If you would like to participate in what we're doing, or if you would like to support us, then please reach out to us at www.columbiaurbanag.org.